In December 2019, in the bustling city of Wuhan, China, a new virus was detected that would soon change the world. Initially, it was just a few cases of pneumonia of unknown origin, but the situation rapidly escalated. As the days passed, it became evident that this was no ordinary virus. It was highly contagious and capable of spreading quickly from person to person. By early 2020, COVID-19, as it came to be known, had spread beyond China's borders. Countries around the globe started reporting their first cases. Major cities that were once filled with the hustle and bustle of everyday life saw drastic changes. Airports were filled with anxious travelers, and flights were grounded as nations scrambled to contain the spread. In an unprecedented move, countries began implementing strict lockdowns. Streets that were once vibrant and full of life turned eerily empty. Shops closed their doors, and people adapted to new routines, staying indoors to protect themselves and their communities. Masks became a common sight, a symbol of the invisible threat lurking around every corner. Hospitals faced an overwhelming surge of patients. Healthcare workers donned protective gear and worked around the clock, often at great personal risk. Scenes from hospitals showed the grim reality of the pandemic: overcrowded wards, exhausted staff, and the constant battle to save lives. Amid the chaos, the global scientific community launched an urgent race to develop a vaccine. Laboratories around the world became hives of activity, with researchers tirelessly working to create a solution that could bring the pandemic under control. After months of rigorous testing and trials, vaccines began to emerge, offering a glimmer of hope. The vaccination rollout marked a turning point. People started receiving their doses, and the world watched as vaccination centers buzzed with activity. Slowly but surely, the rate of infections began to decline, families reunited, smiles returned, and there was a sense of cautious optimism in the air.